Hello.
Hi,
Hi, how are you?
welcome to RBG Podcast. I'm doing great. Thanks for asking.
It's good. That's good to hear.
So, yeah, right now I'm doing a series on people with cluster B personality disorders.
Yes.
So far, focusing on BPD and MPD because, that's what I know the most about. ASPD, I feel like that's a whole other ball game, even though it's in the same cluster. So
Mm-hmm.
maybe we'll get to talk to somebody with that soon. Um, But yeah, so tell everybody your name. Tell us a little bit about you.
Yes, so my name is Haniel Tracy, and of course, I was diagnosed with borderline personality disorder. I believe it's been a year and a half now. But besides that, I am a student at Penn State studying psychology. So I love just learning about BPD and learning about other mental illnesses and just like the entire field of psychology. I just love to study it. And yeah, also, yeah, I'm in my senior year and I am 21 years old. And yeah, I was born in Jamaica, but currently live in PA. So that's a little bit about myself.
That's amazing. Wow, you're a senior studying psychology. So I'm really I think that's really awesome. You'll probably have some great insights for everybody who listens today.
I hope so, yes.
So, are you you said you're 21, right?
Yes, I am.
All right. And are you self-diagnosed or doctor diagnosed?
So actually, well, both. With my knowledge of psychology, I kind of had a feeling that when I was studying it, because I actually took a class a year ago, it was a little bit before I got my actual diagnosis. And yeah, I was in a class, a personality class, and we were studying this disorder and among others in the cluster. And I was really just checking off the list of symptoms, and I was like, okay, it sounds familiar. So let me just go in and actually see if it fits. And it actually turns out that, well, I had ideas that I may be either bipolar or borderline and definitely fit the diagnosis. And when I actually got the official diagnosis, it kind of solidified everything I already knew. So that was that.
Yeah, that's why I hate how people are so quick to go, like, no, you shouldn't diagnose yourself. You're always going to be wrong. You can't
Mm-hmm.
Google your way to a diagnosis. Like, because it's okay. So that's like, they are right in a way. Not
Yeah.
everybody should be diagnosing themselves, but it's totally not fair to write off someone's self-diagnosis because all you need to do to, in my layman opinion, all you need to do to be able to accurately diagnose yourself is to have a really good understanding of what the symptoms actually mean
Yeah.
and have self-awareness. So obviously your psychology background helped you out with that a lot, but I do think that a layman person, if they are, if they're able to self-study and learn enough to actually truly be able to understand what the symptoms mean
Yeah.
and how they present, that they could accurately diagnose themselves. Now that doesn't, necessarily mean if it's gonna like take president over
Mm-hmm.
doctor diagnosis, but I think it is possible. So I don't think people should be so quick to
Right at
write that
all.
off.
Yeah, I completely agree with that. I'm an advocate for that actually. I'm confident that once you are aware, like you said, everything you said was how I feel too, is like if you have the knowledge and seeking that knowledge and you're actually aware of everything that's going around. Of course, not everything is going to be in your awareness, but even just some parts of it, it can help you self-diagnose, and most of the times it is accurate or some parts of it is accurate. So yeah, I definitely agree not to write that off.
Definitely. And are you still are you in treatment?
Yes, so I my first when I first had my diagnosis, it was from a school psychologist here at my university. But then I felt that I may need to see someone who maybe is like in the field of studying specifically
Yeah.
borderline personality disorders, because
Yeah,
I
it's a
felt,
whole nother ball game just being
yeah,
with a psychologist and one who actually understands and like specializes in it. It's a whole nother
it
ball game.
really is.
I would almost suggest, like, if you're struggling with a personality disorder, don't, like,
Goes,
man, I don't want to tell anybody don't go to therapy, but
hmm,
it's definitely in your best interest to have somebody who's familiar with it and
specialize, yeah.
yeah, and well versed in it and well versed in trauma.
Mm-hmm. Yeah, that is true. Yeah, because I know, yeah, for me, CBT, which is the cognitive behavioral therapy, which is specifically used in most therapy sessions, that's like the most common one. That
The gold
really,
standard.
yeah, it is the gold standard. So I would say for personality disorder, it really, well, I can't speak for everyone, but I know it's harder for that to help people with BPD. We would have to do, I know, dialectical behavioral therapy, psychotherapy, and trauma-based therapy is more effective in that in most cases. But like I said, everyone's different. So seeking out whatever works for you is what
Yeah,
I
whatever help you
say.
can get,
Yeah.
definitely.
Hmm.
And that's another thing. It just made me think of with what we were talking before. Not everyone can afford to like go see a doctor, and it takes
Yeah.
a while to accurately diagnose a
It
personality disorder.
does. Yeah,
Not
sometimes.
everyone can afford to go to therapy or even stay in therapy that long. So if your self-diagnosis is all you got, use that and use the tools you can find to work with that.
I completely agree with that too, because yeah, specialized therapy is really expensive, and it just to go into that process is a long and expensive route to take, and not everyone is able to do that. So yeah, I was very lucky because my experience doing therapy, it took a long time. It took actually years to get a good diagnosis that was accurate, because I was officially diagnosed with a bunch of things that didn't fit, and it took
Which
years.
is really common for
Yeah.
people with BPD. Really common.
It is. Yeah. So it took years. So I would say it's a patient process. You could work with what you have sometimes, and that can help in a way.
So can you tell us a little bit about prior to treatment, what your symptoms were and how they would present?
Yes. So, yeah, before I started official treatment for BPD, I was fluctuating with a lot of instability, like emotional instability, which I know is basically they call it, that's the other name for BPD, is that emotional instability. So from a young age, I always felt like I was very hypersensitive to my
Mm-hmm.
surroundings, and I would have my mood shift constantly, and that's why at first many people in my family thought I would have bipolar instead, which is common. 'Cause they have some similarities, but yeah, that.
But the difference is, I'm so sorry to cut you off,
Oh yeah.
but think this is super important. I want people to know this.
Mm-hmm.
The difference between, and correct me if I'm wrong, because you're the one in school for psychology. I'm just
Yeah.
a layman who reads a lot.
Uh-huh.
Um, so the difference is with the mood, emotional instability with bipolar disorder, it's chemical. It's more, it's almost completely chemical and
Mm-hmm.
not influenced by outside factors. The emotional instability with BPD is usually almost always influenced by external factors, like something happens, then your mood drops, or something happens and your mood shoots up. Correct?
Yes, that is
Yeah.
100% correct. Yeah, that is a good difference, because I know it's sometimes hard to differentiate them because it has some many similarities, but yeah, it is very different. And yeah, I would say with the bipolar, the up and down moods, they appear very different. So the fluctuation of them are different, and it's not really caused by the external or the interpersonal aspects of it. So that's completely correct. Yeah.
What other, I'm sorry, but cut you off. Back to
Yeah.
what your symptoms were and how they presented.
Yeah. So yeah, like I said, the one of them was for me the ups and downs and the emotional instability, just yeah, just feeling very intense moods, and like you said, going back to it being caused by external circumstances. if the relationships I had to my family, friends, romantic relationships, they were very unstable too. And I would have a lot of triggers. I've recently identified them as triggers now, but before I didn't know that they were triggers, but relationships and traumas that I experienced in my life at a young age would trigger me to have these fluctuations of my emotions that I wasn't really in control of. Well, I felt like I wasn't at the time. And also, yeah, I was in a depressive state at moments. And yes, social anxiety was a big one because I was misdiagnosed with the anxiety, overthinking, and social anxiety. But yeah, those are all symptoms now, but before they were given like their own diagnoses. But that was something that affected me, as well as yeah, the impulsive aspect too. That is a major one that appeared for me, and it's something that's kind of taboo to talk about, since the issue of like impulsiveness in relation to like a sexual nature, yeah, it's hard to talk about, but that is something that I faced in my life, was not being able to have those inhibitions to just do whatever I want to soothe myself. So that was a coping mechanism that I was using that was also spiraling me downwards into the other symptoms of me being very emotional at times and up and down. So yeah.
So let me ask you this: when you mentioned the sexual aspect of the
Mm-hmm.
impulsivity, and
Yes.
once again, anything you don't feel comfortable talking about, you can just tell me, nope, not going to talk about that, and that's okay.
Yes, that's
Um,
fine.
but so I talked to a therapist about this really recently,
Mm-hmm.
and I believe that they were trying to express that sometimes it can look like sexual impulsivity when it's really just passivity, and
Mm-hmm.
sometimes due to trauma, and you're just doing what's expected of you. You know,
Yeah.
when you're in a situation with a guy and there's pressure and you're just like, well, I guess I have to do this because he wants to. Do you think it was
Mm-hmm.
closer to that end of the spectrum and like trauma induced, or do you think it was actual sexual impulsivity?
Oh no, I agree. That's interesting that you brought that up because I never looked at it that way, but that kind of does make sense in my case because yeah, it's with the passivity is that I'm going to do what's going to make other people happy or feel good, and is that like people pleasing aspect of, I'm not sure if that's the actual symptom, but in my experience is like I didn't really have those boundaries because of those traumas in my life. So when I would get into like environments where I would be very like vulnerable, it would be me being passive because I wasn't creating those boundaries for myself. So yeah, it would look like me being impulsive because after a while, I mean, I would say it's both because after a while it was like me continuously spiraling down that, but it began with that passivity. Yeah.
And I believe, I don't want to speak for this person, but I
Yeah.
believe they were using this to make a point on how people are misdiagnosed, and how
Mhm.
that's something that can look like an impulsive symptom of people are misdiagnosed with BPD, and that can
Mhm.
look like a symptom of BPD when it's really just a symptom of like being passive due to trauma.
Oh yeah, I agree. Because even if you don't specifically have BPD, that even in trauma situations, it's having that passivity where you don't want to. Yeah, you're just going with everything around you. You're not really in. You feel like you don't have control over your circumstances, so you're going with what is expected, like you said. So yeah.
So this is a question I ask everybody,
Hmm.
because lack of empathy is a cluster B thing.
Yeah.
Do you feel you have empathy?
Oh, that's interesting because I recently, not recently, but in the past, I felt like I was, well, I identified as an empath, but I'm starting to rethink that identity as me being someone that is always giving so much and not really getting. So I know an issue with that is a part of my BPD that I've talked to my therapist about was, yeah, like I said, not setting those boundaries for myself. So I'm always giving more because I wasn't setting those there. And then not feeling that I'm receiving the same type of love. But there is a sense where it's kind of like more self-centered. So the need to want to receive love in the way I want to, and not really being able to see things for how it is. So idealizing, I know that's one of the symptoms, is having these images of things and people that are fabrications of our minds. So they're not based on, we like overlooking, I would say. So it's overlooking a lot of reality, what was going on around us in certain moments. And then I know the notion of splitting. So we would go from idealizing, so seeing someone as the person we want them to be, and then being able to, and then suddenly switching to, oh, I really don't know because I created this notion of this person. That's not really who they are. So I know that's something I've experienced a lot. And people I know that also have BPD have talked about that, and videos I've watched and books also talk about that notion as well.
Gotcha. So
Mm-hmm.
you thought you had empathy because of
Mm-hmm.
how giving you were,
Yes.
but then you realized there was a selfish component behind it because you were giving to receive.
Mm-hmm. Yeah.
So I can relate to that. That's why, like, I kind of struggle with this image of people with BPD as like these monsters,
Mm-hmm.
because some of the people I know with BPD can be the most giving and generous people that I know. Like, but it isn't always in a healthy way. Sometimes it's like a real lack of boundaries and like, oh, I'll do anything for you, and then they
Yeah.
get burnt out, especially because they're not getting it all back in return, because the other
Mm-hmm.
people person usually does have boundaries. But it bothers me that that's overlooked. And you can say it comes from a selfish place because you are wanting that in return. But is it really a selfish place? Are you really, is your only motivation for doing all these things for another person just to get it back? Or is it because you actually care and you also hope to get it back?
Yes. So yeah, I want to talk. Yeah, I'm happy you brought that up because yeah, it was hard for me to, because there's a lot of stigmas, unfortunately. There is
Mm-hmm.
so much stigmas that I personally devote my career, hopefully in the future, to changing a lot of the stigmas related to BPD and other mental illnesses.
And
But
that's what this podcast is
yes,
for
I that's
too.
yeah,
We're
I
working
love
together.
it. We are. I'm happy. But
Me too.
yes. So yeah, so with the stigma of yeah, not being I guess like being self-centered or selfish with not like giving to receive. I feel like everybody in a sense gives out with the hope of receiving back. So
Exactly.
yeah, I wouldn't say, it's hard to say, it's hard to pinpoint that specifically to people with BPD because I feel like everyone in a sense does that. So I don't believe it comes from a malicious place or it comes from a selfish place, because we do actively just give love. We try to share, and like I know being aware of BPD, just the constant for me, the constant need to self-reflect and to look at our actions and to try to make relationships work, because it is so hard for us, and to make situations, like make our environment a happy place despite what we're going through. That is out of, that's selflessness. That's out of our need to want everyone to be happy and be okay despite what we're experiencing. So I definitely don't think that stigma doesn't have any reality. It really is.
Yeah. I
Yeah.
definitely think the lack of empathy is, I don't think that should be and I don't think that should be a criteria for BPD, because for one, because of how emotionally sensitive people with BPD are,
Mhm.
they are super protective of other people's feelings.
Oh yeah.
When they're in a stable place, they are super protective of other people's feelings. Because when somebody, does something to to a non-personality disorder person that would feel like a paper cut, it feels
Hmm.
like someone with BPD just got shot in the leg.
Oh
So they're gonna
yeah.
so even though it's not really, even though it may not even be needed and isn't like based on like how the other person might be feeling, they're going to be like, no, I don't want you to feel this pain. They're going to be
Hmm.
protective over that. Where
Oh
the
yeah.
lack of empathy um criteria I think comes from is when people with BPD are in that extreme unbearable emotional pain.
Oh yeah.
And I just don't think it's like, I don't think it makes sense clinically to call that a lack of empathy, because if anyone were in that amount of emotional pain, it would be harder for them to think of others because it's the pain is just so much.
Yeah.
So like
I.
if someone's like, say for instance, if someone's dad just died, people would not
Mhm.
blame them for being, the only difference is that people with BPD get there a little bit easier.
Yeah.
And once they learn how to control and manage those extreme emotions, I don't think, and once again, I always have to say this, there's different levels of severity.
Mhm.
So I am generalizing a little bit. I'm speaking from anecdotal experience from people that I know and that I've talked to and worked with.
Mhm.
Um, so that's not to say that there isn't somebody with BPD out there who's just like, haha, fuck you, let me piss in your Cheerios because I have no empathy. There might be, and if anybody has been a victim of somebody like that, this is not
Yeah.
to invalidate your experience at
Right.
all. But I feel like from my knowledge, from the people that I know, it's not a lack of empathy. It's just an inability to deal with their emotional pain. So they aren't really capable of looking past their pain in those moments. But as soon
Yeah.
as that pain is over, then what? Then it's like, oh my God, I am so sorry. I
Yeah.
was such an asshole. So much empathy. Like how, like I see how you felt from my actions. I feel so bad. So I don't get how they can. I think that needs to be relooked at clinically because I don't think that can be classified as lack of empathy.
Yeah, I agree with that because yeah, it's a moment I look at it as like an automatic response. And with a lot of yeah, it's like with mental illness overall, many of them, it's a survival response. It's a trauma response. In it, like you said, in a case where someone went through an event that that reshape, because you know something, it reshapes it. Your brain is plastic, so it's all constantly reshaping and adjusting, and these behaviors are becoming normalized within you, so they look like automatic responses, just like survival instinct, so they'll chip in moments where you're not aware, but like you said, in the moments when you do become aware afterwards, you're able to rectify the situation. So it's, I know in my personal experience, I feel completely terrible when I'm in a moment where traumatic
Oh,
experience. So something
I
would
lost you for
trigger
a
me.
second.
Oh, hi. Can you hear me?
Yeah.
Okay. There. What part were you at? Sorry.
No, I think it only cut out for a second.
Okay. Yeah. So I was saying it's an automatic response. So in my personal experience, when I was in a place where I was triggered by something someone said, or I was reliving a trauma and having flashbacks where I have in the past, I I had to protect myself. So I shut down and became defensive and became centered on how am I going to soothe myself? How am I going to take myself out? And sometimes that looks like disassociating. Sometimes that looks like being extremely angry or sad or emotional. And those are automatic. And then once I am out of that state, it's more of the awareness. And the more, I'm not going to say the more it happens, the more you get better at it, but it comes with that awareness. And yeah, it's like you have a mental illness, you have something that has affected you and created an imprint on you. So it takes a process. And that's why it's good to be aware, because I'm happy when people are able to get a diagnosis or look into it and try to figure out, which most, I would say most people I've encountered have, um is being so aware, because I think I've seen a study that talks about the awareness of people with BPD versus a lot of the other cluster B personality disorders. being able to know what's going on, and sometimes you are not in
Wait, did that
control of.
study say that people with BPD are more self-aware?
I don't think it said more self-aware, but I don't know if it compared it exactly like that, but they said they do have a strong sense of self-awareness.
I would say I would personally, from my experience, say definitely more
Mm-hmm.
self-awareness than other
Yeah.
cluster Bs. Honestly, I'm bothered that BPD is even in cluster B.
Yeah, I'm very surprised too. I was
Because
wondering the
it is
same thing.
so different than, like, I get. See, they cluster them together because of how the
Mm-hmm.
symptoms present.
Present, yeah. Yeah.
But when you really get down into it, not even that deep into it,
Mm-hmm.
like, there is such a difference. Like, and you tend to see more empathy, I believe, from cluster B personalities. You tend to see,
Mm-hmm.
like, less intentionality,
Yeah.
even though there's empathy and an intentionality of actions from at least NPD. I haven't really done much research on ASPD,
Mm-hmm.
um, or histrionic. But aren't they thinking of getting rid of histrionic anyway? Because it would kind of
Yeah.
fall under BPD or NPD anyway.
Yeah,
But
they
hey, shout out to
do.
all my histrionic peeps. We're not erasing you. You're
Yes,
important too.
definitely.
But I'm surprised it's even in the same cluster. Like, I don't know. But hey, 10 years ago,
Mm-hmm.
being gay was in the DSM.
It
So change
was,
is
yeah.
coming.
Changes
Change is
and
coming, and it
yeah.
needs. I hope it comes fast, because this the way people look at cluster Bs is a cluster fuck, pun intended.
Mm-hmm. I completely agree because as someone that wants to go in the field, there's a lot of stuff that I don't necessarily agree with how these diagnoses are coming together sometimes in the clusters because like you said, they're very different. And I mean, I'm happy the DSM really revises it. Hopefully, like you said, there's more revisions, but yeah, it just sometimes it can feel like just grouping for simplicity and for maybe not us as people who actually have this disorder, but more focused on the practitioner
Yeah,
and
yeah.
the therapist. So I look at it like that sometimes that maybe there can be more centered towards people who actually have the disorder and vice and how versus how it is now. So
But
yeah.
even in a clinical sense, I don't even think
Mhm.
BPD being in cluster B makes sense, even in a clinical sense.
Oh yeah,
Like,
it does it. It
from,
has a
yeah,
lot
even
of
from,
work.
like,
Hmm.
diagnostic, like, for diagnostic purposes, I don't even, um yeah, because I mean, like, they're going by the way symptoms present. They're going by, like, what's called
Yeah.
dramatic, erratic, and all that stuff. um
Hmm.
and it's like, okay, I can have a rash, and it can be an allergic reaction to some peaches, or it could be
Hmm.
bed bugs. Same presentation, but two completely
Oh
different things.
yeah.
So I don't think that's a good way to do it. But also, I'm not a doctor, so it's really easy for me to sit down and criticize from the outside looking in. I can just imagine if this video gets attention, people being like, "Shut the fuck up! You're not a
Oh
doctor."
yeah.
And I'm not, but
uh,
I am a
it
person
makes you
who's
make a
like,
good point.
who's lived certain experiences, and who, like, has, a little bit of knowledge. And I think what
Yeah.
I'm saying is valid. um
Yes, it is. Yes, definitely valid. You make great points because that is true. That is, even though I'm not a licensed psychologist and we're
Not
doing our
yet, but you're
own,
on
yeah,
your way.
not yet, yeah. So we still have, yeah, we should be able to share our views on it and yeah, and hopefully there are revisions overall and changing the stigma. Hopefully that all gets better with time.
So, you mentioned the stigma. How has the
Hmm.
stigma affected you? How has it affected your treatment? How has it affected your recovery?
Yes. So my with my treatment, unfortunately, not a lot of people in my life do know that I have BPD, and it's not that I'm more comfortable than I ever have been with my diagnosis and not afraid to share it. And even in my own podcast and everything else, I love to share and change the stigma in any way I can. So just talking about it more openly. Yeah, so with my treatment at first, it was something that I was afraid to share. I was afraid to open to it. I felt like I had to keep it within myself. And that kind of made me feel worse at the beginning of my treatment is I felt like I had to keep everything a secret, and I was really inside my head with a lot of stuff, and with the symptoms of me being so anxious and overthinking a lot, was it was continuing to build on that. So in the beginning it did hinder my progress. And then I started to realize that if I do want to do this work, and I do want to do the work with myself too, um, then it's okay. It's okay to talk about it. It's okay to accept some things, and not accepting that these things are complacent and I should just let it be, but just accepting that this is a diagnosis that I can work on and continually improve on, and I am not my diagnosis. So it's like
Absolutely.
knowing is yeah, it's knowing when to identify with it, but also not let it be your sole person. Like not really say I'm this and I can't change. So yeah, that was my experience with that.
Have you ever experienced any prejudice because of your diagnosis? Like saying like, oh, I have BPD, and then somebody, judging you, assuming that you're a manipulative asshole who's gonna like
Oh,
yell at them.
yeah. So actually, I haven't had any prejudice from anyone that did not have the disorder or have mental illness at all. But I actually faced that discrimination when I tried to seek treatment. So I
Mm-hmm.
was at one point I was in a institution where I got help, and I'm very happy to have been at that point in my life go in and seek treatment. But yeah, there was one psychiatrist that I had that yeah, treated me like just invalidated me the whole way through. So made me feel as though I didn't know what was going on, and I was harmful to myself, in that I needed to just sit back and just let things happen to me and let the treatment happen, and not really be invested and involved in the treatment of what was going on. So based on my diagnosis of BPD, so that was very disheartening, and I fought through it. So I encourage anyone that feels invalidated by a therapist or
Yes,
a practitioner
absolutely.
to definitely continue to speak out, because even though they have a degree or a license for this, you that doesn't mean that your voice should not be heard. So I had experienced that. It was terrible, but I was able to continue to speak up, and it felt much better. So yeah, it's very harmful when there's people in the practice that don't really care as much, but obviously that's not the vast majority. So that's great.
I have so much to say about that. One, you are absolutely right.
Yes.
Any person with BPD or not hearing this, it does not matter that your therapist holds a degree or a certificate. Obviously, their knowledge and expertise should be respected, but
Yeah.
that in no way, shape, or form overrules the fact that you know yourself, you know your mind, you know your body, you know what you need, and you have the right to have a voice in your treatment. Don't let anybody tell you otherwise. And if your therapist tries to tell you otherwise, find a new therapist. Not all
Yeah.
therapists are good. And
Yeah,
and
that is true.
especially if they are not, if you have a personality disorder, especially if they are not, if they don't specialize in trauma, and if they aren't well versed in personality disorders. And here's the other scary thing. Here's a really scary
Hmm.
thing. Um uh, like there is stigma. It's not just the outside world where you have to worry about stigma with
Oh
BPD.
yeah.
It's
It's the
also
inside. Yeah.
within the mental health community, like
It is.
professionals.
Mm-hmm.
Like I like, oh man, I know of stories where like somebody told their psychology professor like, oh, I think I might have BPD, and then they looked at them with like disgust, and then made a comment in
Wow.
front of the whole class about how people with BPD were manipulative and
Oh
evil.
wow.
Like I know stories just like yours where people go into treatment and they're automatically invalidated.
Oh
People used to
yeah.
think that people with BPD were were liars, like all the time
Yeah,
were liars. So they would go in and not get effective treatment because people would assume they were lying. And it is, oh my gosh, it is infuriating to me because these are
yeah,
people who need help. And like, I have not met a single person with BPD who was not fighting and trying so hard to be better, not just for themselves, but for
but
those around them.
yeah,
And these earnest, big hearted, caring people are being destroyed, and their ability to get treatment is being destroyed by the stigma, even amongst the people who are supposed to be trained and certified to help them. And it's fucked up, and it needs to change.
yeah, it definitely needs to change. It is so disheartening to hear that because yeah, I've read a lot of things on BPD and my own psych professors. I them personally haven't been like that, but I've heard many stories and I've seen many videos of people just putting out this bad image of like you said, the manipulation and the hypersexual nature and just everything. But even besides, not speaking of myself, but other people I know that do have that same experience with BPD, they're very caring people that just wants to get better.
And let's see. Well, we're running. Man, I could talk to you forever. I really hope you come back on
Hey,
and do another segment with me.
definitely,
But
of course,
we're at
would love to.
35 minutes, got to wrap it up. So the last
Yeah.
question I would ask you is if you could tell somebody one thing so they could truly understand what it's like to have BPD, instead of seeing how these symptoms present and all of the ugliness that this disorder can cause, give them a view from the inside looking out. Show them something. What do you want to tell
Mhm.
them? What do you want to show them?
Yes, I would want to say that look at see there's so many positives with BPD, and I know many people may not see them at this moment because like I said, the stigmas and the own awareness and just everything internally and externally may feel like a burden, but let me tell you, it's not. You have so many gifts. You have the gift of empathy. You have the strength because you've been through so many traumas. You've been through so many hardships and you got through it. You continuously get through it day by day and you just want to shine that light outwardly. So I would say look at the positives. There's so many positives to this. This is not a curse. Sometimes it may, like I said, it's hard. Life is hard for everyone and life is hard for you. And just continue to fight because there's so many reasons. Um, there's so many reasons why we're here and we're existing and we get through it day by day. So you're, as cliche as it sounds, I hate when people tell me this too, but you're strong and that is like actually true. Yeah, I would say it's just very true and I want everyone out here, even with people without BPD or with BPD, like you are continuously getting through it day by day. So even the most simplest things, you should be proud of.
That was beautifully said. And yeah, I really hope to talk to you again. I'm going to shoot you a message right after I end the recording. I want to thank you so much for coming by. Oh, do you want to plug your podcast while you're here?
Oh, yes. Thank you so much. Yes. So my podcast is called the Archangel Podcast. It is on Anchor, it is on Apple Music, and I just like to unpack everything. So psychology, spirituality. I love to just talk about my experience and what I've noticed in the world and see. I also have interviews too. So hopefully you'll be on one of those. So yeah, I just
Anytime.
like to unpack everything. So yes, check it out. Thank you so much for having me. I'm happy to be here and be able to share this experience and just bring more light and more knowledge to the topic. So thank you so much.
All right. Thank you, Haniel. And I'll be messaging you in a second.
All right. I will see you then. Thank you. Bye bye.
Bye.